Well, I think the big issue is that there's so much we aren't reporting. I think the things that we do report are potentially useful to some people. A lot of it is useful to the professionals. We measure technical details and whether or not people are keeping up with guidelines that are developed by specialty organizations. But we often don't measure the things that the patient or potential patient would want to know. There are some exceptions to this. So, for instance, we've got a good maternity suite in calhospitalcompare.org where a prospective mother can learn about the services available. You know, is there a specialized intensive care unit if, God forbid, something went wrong? Will I learn to breastfeed if I use that hospital, and so forth? But for the most part, it's much easier to think of places where there are holes in terms of what consumers would want to know than places where those holes have been filled. So if someone wanted to have their knee replaced, they couldn't go yet to calhospitalcompare.org and say, how well will I be walking 6 months from now? But I think we need to add the things that are easier for patients to understand and that are really what they're there for. As an example, in pneumonia, we currently report, did the patient get an antibiotic that's in keeping with guidelines? Did they get the right antibiotic? And I'm sure every single patient hopes they get the right antibiotic. But no one's with pneumonia is going to the hospital thinking, boy, I hope I get the right antibiotic. They're thinking, I'm feeling short of breath, I'm coughing up a bunch of stuff. I hope that when I leave here, I'm ready to go home. My cough and my shortness of breath are gone, and my strength is back. And we don't give them that information. In fact, even when we give them outcomes, so it's a difference between technical details and outcomes. And even when we give them outcomes right now, because most of the performance measurement in hospitals grew out of systems that were designed to identify mistakes, the outcomes we give them are the bad things, like I had heart surgery, will I die? So that's important. No one wants to die when they have heart surgery, but mainly the reason people are going to get heart surgery is they have chest pain. And we don't give them, I had heart surgery and now I'm pain-free. And that's, since maybe 2% of the people will die, the other 98% need to know, am I any better? And would I have been better if I'd used this hospital or that hospital? Or would I expect to be better at this hospital or that hospital? So reporting good outcomes is something we haven't done a lot. And that's what I think most patients or potential patients would be interested in.